If you have scoliosis, you've probably been told to keep your core strong. And there are so many core exercises out there. There are, thousands of core exercises. So which one do you do to help your scoliosis? A recent study looked at one specific exercise, core exercise for scoliosis, and one that's directed specifically to the extensors of the low back. It's called the Superman exercise, and you may have heard about this exercise, and the question is this a good exercise for someone with scoliosis? And that's what this research article looked at. So a Superman exercise is this. You lay on your stomach, you put your arms up and your legs up like this, and that works your low back muscles. So you can do repetitions, you can hold that, but what it does is it works the paraspinals, so the muscles that are right here along the back, and it works those a lot. So we get good activation out of those muscles, specifically the multifidus, the longissimus, the deeper rector spinae. Those muscles get a lot of activity. But in someone with scoliosis, is this a good exercise? So that's what the research article looked at. I want to show you what it looks like on someone who's normal, quote unquote normal, with paraspinals, and someone who has scoliosis, what that looks like and what the differences are, and then we'll come back and we'll talk about it. Okay, I have Marco here, who's a PT student that's with us for 12 weeks, which means we get to torture him a little bit. We're going to demonstrate what the paraspinals look like in someone that does not have scoliosis, in normal paraspinals. So the Superman exercise, Marco, go ahead and demonstrate a Superman exercise. Good. So we get some lumbar activation. Pull your legs up off of the table too. So a true Superman is arms up and legs up. Go ahead and go back down. And if we want to be even more specific, can you get your arms all the way in front? There we go. Arms and legs up, which puts a lot of load on the lumbar paraspinals. Good, Marco, go ahead and relax. Come a little closer and let's take a look at his paraspinals while he does this. So Marco doesn't, well, at least I don't think Marco has scoliosis. So, so if we want to look there, Marco, go ahead and do another. Perfect. So we see activation of the paraspinals on both sides. And good at, maybe we should see how long Marco can hold that. Just kidding, Marco, go ahead and go back down. So Marco actually has a little bit of a prominence on his right side, which is interesting. Go ahead and do it one more time. So a little more prominence on his right paraspinals than his left. Go ahead and relax. We'll have to look into that a little bit further with Marco, but that's pretty consistent with what we see. We see both sides of the paraspinals really activate, and we have good activation in the multifidus, the longissimus. I mean, we could go through all the different muscles that this activates, but a lot of good lumbar stabilization muscles. So now let's go and look at someone with scoliosis. Okay, to demonstrate a Superman exercise with the lumbar paraspinals with someone who has scoliosis, we've recruited Annie to help us out. Annie, thank you for helping us out with this. First of all, I want to show you what Annie's scoliosis curve looks like. So go ahead and turn around, Annie, and just stand there for a second. So Annie has a right thoracic and left lumbar scoliosis curve, which has actually been reducing with doing Schroth exercises, which is pretty cool. Go ahead and bend down, touch your toes. So here we can see a prominence on her right side where her thoracic curve is. Come up just a little bit, Annie. Up, right there. So we can see a prominence on the right side where the thoracic curve is, and then a prominence on the left side where the lumbar curve is. So go ahead and come back up. So go ahead and lay on your stomach here, Annie, with your head here, and just stay relaxed there for a sec. And we're just going to pull this up a little bit so we can see your paraspinals. And okay, so go ahead and do a Superman. You know what a Superman is, so we're going to go on both. Perfect. So arms up, legs up. We see the paraspinals activate, and we're seeing less size on that right side. Go ahead and relax back down. That's a fun one to hold for a while, isn't it, Ian? So yeah, definitely I can feel more activation on that left side compared to the right side, and we see it's a little more dipped in. Go ahead and relax back down. So it's with her just laying there. It's kind of hard to see on video, but this right side is higher than, the left side is higher than the right side. So go ahead and do it one more time there, Annie. Perfect. So we can see more activity on that side. Do you feel it more on this side?
Yes.
Yeah? Okay, go ahead and relax. So we feel more activity, we're seeing more activity. Definitely I can feel it as I palpate that as well. So thank you, Annie. Okay, so we saw two examples of someone who's normal with the Superman exercise, and actually since we did that video we kind of looked more in depth, and he has a right thoracolumbar scoliosis. So not totally normal, but it was a good example as well. And we saw someone, Annie, who has scoliosis and what the paraspinal difference is. In the study it showed that when we look at EMG activity of those paraspinals, the convexity is more active than the concavity. Why that's important is the Superman is not a very good exercise for treating scoliosis, because we're encouraging the asymmetry. We're encouraging the convex side to be more active when the concave side isn't as active. So we need to do scoliosis-specific exercises that target the concavity to wake up more and to open up and tone down the convexity paraspinals. Paraspinals are great muscles to work. If you have scoliosis, I highly recommend you look at doing the Schroth method, which helps to cause more symmetry in the spine so that we have more activity where we want it and not where it's already more active. Most of the patients who have back pain, low back pain, that have a lumbar curve, have it on the convex side of the curve. And so we don't want to encourage that to be more active. We want to encourage more symmetry. So I'll put the link for that research article in the description below. And don't forget to subscribe and check out other research reviews that we look at. Thanks for watching.